The very last bill that President John F. Kennedy signed into law was the Community Mental Health Act of 1963. President Kennedy believed then, as we believe now, the people who experience mental illness need more than just medical care. They need community care. I'm Rich AMBROSINO, Executive Director of Shore House, an accredited clubhouse with a unique program offering social, educational, and employment opportunities to restore hope, independence, and self-worth to people living with mental health challenges. Today, 1 in 5 people experience mental illness, yet access to mental health care still remains a challenge for a large percentage of the population. Can you believe, with so many people affected, that Shore House is the only accredited clubhouse in New Jersey, and that we receive zero funding from the government, Medicaid, or private health insurance? To continue the family tradition of helping those dealing with mental illness, former Congressman Patrick Kennedy, President Kennedy's nephew, founded the Kennedy Forum to lead a national dialogue focused on transforming our healthcare system to better address mental health. In this next clip, Congressman and Amy Kennedy speak about how they see Shore House as a key to achieving his uncle's mission to aid those suffering from mental illness. We are so incredibly grateful for their support, and we ask you to join us at this critical time, and please donate today so together we can give people the help they so desperately deserve. Thank you for listening, and thank you, Patrick and Amy.
Thank you, Rich AMBROSINO, for your leadership there at the Shore House. I love making waves for mental health. What a powerful mission you have for helping those amongst us who need supports, for whom the medical system really fails them. We need more than just medical care. We need community care. And that was really the vision of my uncle, President Kennedy, when he signed the Community Mental Health Act of 1963, the last bill before he was tragically assassinated. He said at the signing ceremony, people with mental illness, quote, need no longer be alien to our affections or beyond the help of our communities. He didn't say beyond the help of our psychiatric hospitals or our terrific psychiatrists or, our pharmaceutical industry. He said communities because he knew that it was supportive housing, supportive employment, supportive living, which is what you guys really do so well at Shore House. That's the model we want. And it's a model that we're not getting, other than in rare places like Shore House that are really stepping up. I mean, we're the most populated, one of the most populated states in the country. We should have more than one Shore House. And I'm just honored here with Amy to support your mission and to let you know we're behind you and all that you're doing, and we want to continue to help expand the whole movement across this state so that Shore House is not alone and that clubhouse models are going to be available in every county in this state.
The clubhouse model that offers friendship, employment, housing, education, and access to medical and psychiatric services in a single caring and safe environment. This type of social and economic inclusion helps to reduce suicide, hospitalization, and incarceration. It's all about providing a continuum of care and that critical peer-to-peer support. Without it, people often end up back in the system. And it's also about efficiency, being able to reduce the cost. 1 in 5 people in New Jersey has a mental illness. It touches every family, including our own. And we all know well that there is a need around us. We'd love to see you down here in South Jersey as well. And despite being the most densely populated state in America, we remain woefully behind the rest of the nation in addressing mental illness. We know what it means to try and do this without support. It's universally recognized and a proven model, and we are so excited about the work you're doing and hope it continues.
So I look forward to continuing to work with my great friend, Frank Pallone, who helped us pass the Mental Health Parity and Addiction Equity Act when I was in Congress, who's a great champion for this cause. And Amy and I, we're going to be doing everything we can to join you in getting you the needed financial support from our community, our businesses, and the state. And really, this is like the model. And unfortunately, the incentive system doesn't incentivize this type of care, even though it really is the kind of care that helps people be celebrated for who they are and not treated just for what their diagnosis is. And that kind of human recognition is what Shore House is all about. We want to thank you for that and want to help you get the resources to provide for extra transportation, so vital to your mission, and for the added services that are going to be so helpful to the people that you include in your community, who are often excluded from the community around them. So thanks, Rich. Thanks to the board and through all of your staff that do the work. I can guarantee you, you're not doing it for the money. You're doing it for the mission, and you really need to be saluted and thanked for that.
Thanks, everybody.